Colon cancer is the cancer of the large intestine, which is the lowermost part of the digestive system. Rectal cancer is the cancer of the last 15 centimeter of the large intestine, and together they are often called as colorectal cancer. Many patients who are in the early stages of colorectal cancers do not have any symptoms at all. If they do have symptoms, they may have passed out blood in the stools, or they have change in their bowel habits, such as diarrhea or constipation, or change in the consistency of the stools, or the caliber of the stool may get narrower. The other symptoms include generalized abdominal cramps, pain or discomfort, and which is persistent in nature. Unexplained weight loss, generalized weakness, and fatigue are some of the other symptoms of colorectal cancers. Colorectal cancer is the second most common cancer diagnosed in Malaysia. It is the most common cancer among male and the second most common cancers among female, which is only second to the breast cancer. Chinese, unfortunately, has got the highest age-specific incidence rates among all the three major races in Malaysia. Age whereby their higher incidence of colorectal cancer is above 50 years old. Most colorectal cancers begin as small clumps of cells or growth, which we call adenomatous polyps. Over a period of time, these adenomatous polyps may become colon cancers. In most cases, the causes of colorectal cancer is unclear. However, there are some inherited genetic mutations that may increase the risk of developing colorectal cancers. For example, familial adenomatous polyposis, or in short we call it FAP. In these patients, whole of the large intestine, thousands of polyps in the colon. And these patients usually get colorectal cancers before the age of 40 years old. Certain precancerous growth in the colon and rectum, such as the adenomatous polyps, may progress to become colon cancers. The tests to detect colorectal cancers include colonoscopy, X-rays, and the CT scan. Colonoscopy is the fiber optic, slender, long camera that is introduced through the anus to view the entire large intestine. It is done under sedation. If there is any abnormality noted in the large intestine, biopsy or tissue sampling can be obtained for analysis, or if there are polyps, it can be removed immediately. Multiple CT images can be reconstructed to create what we call a virtual colonoscopy to get a picture of the inner lining of the large intestine. And X-rays can also be used to diagnose colorectal cancer in the form of double contrast barium enema, whereby barium, which is a contrast fluid, is placed into the large intestine, and followed by air, and multiple X-rays are taken to view the lining of the large intestine. If there is any abnormality, colonoscopy might be required to confirm the diagnosis further. The main treatment of colorectal cancer is resection of the primary tumor and also the removal of the regional lymph nodes. It may be combined with chemotherapy or radiotherapy or both to improve the outcome of treatment and to prolong the survival of the patient. Be aware of the colorectal cancers and live, if you do have any family history of colorectal cancers, go for a screening colonoscopy at an earlier age. Otherwise, if your average risk, you should go for colonoscopy at the age of 50 years old.